Hello everyone. Uh, we are discussing about the pharmacokinetics of drug. We already discussed the two movement of drug, that is from site of administration to systemic circulation, that is absorption, and then from systemic circulation to various tissues to or the body fluids, also the different organs, which is distribution. So we concluded absorption and distribution. Now let's move on to the third movement of drug, that is metabolism. So what is metabolism? It is also known as biotransformation. So it is transformation of drug from active to inactive form of drug. Why to convert the drug from active to inactive? So body has the mechanism, mainly liver responsible for the metabolism, converts active drug into its excretable form, mostly polar compounds or excretable, that is the drug which are water soluble can get solubilized in water and it can excrete through urine or bile. So the main function of the metabolism is conversion of the active form of drug into its polar form of drug. So why this have to be taken place? Mainly because of detoxification. So metabolism is the detoxification mechanism by which the drug is eliminated out from the body. So metabolism plays an important role in detoxification. So not only conversion of active to inactive form, even sometimes inactive form of drug can be converted into active form by this metabolism, mainly in case of prodrugs. In prodrugs, we administer the inactive form of drug, which will further convert into its active form with the help of some enzymes. So the conversion of active to inactive or inactive to active drug needs enzymes which is present in the liver. These enzymes are synthesized and present in the liver, responsible for the metabolism of drugs. Not only in liver, intestine also has enzymes. Also eye, saliva, in intestinal region, in GIT, intestine, even the gastric media stomach and vaginal cavity also has some enzymes which are responsible for metabolism of these drugs. They are all microflora necessary for maintaining the environment. Microenvironment is maintained because of the enzymes present that helps in conversion of the active form of drug to inactive form suitable for elimination from the body. So metabolism takes place by two phases. One is phase 1 and phase 2. Phase 1 reactions are known as functionalization reaction, whereas phase 2 is also known as conjugation reaction. So the drug converting from its original form to another form which is suitable for elimination. So you have to convert the drug into a polar form or water soluble form. How that is converting? It is by means of either phase 1 reaction or phase 2 reaction. So liver has its own mechanism to convert the active form of drug into water soluble form or easily eliminating form. So phase 1, which is known as functionalization, there some functional groups will be added to it or there will be modification of the functional groups to the polar group of the drug. Mainly phase 1 includes oxidation, reduction and hydrolysis. So the reactions by oxidation, reduction and hydrolysis comes under this phase 1 type of metabolism, and the drug gets either oxidized or reduced or hydrolyzed and will convert into its eliminatable form or the polar form of drug. So mainly drug will attain either OH group or NH or SH group to eliminate out from the body, or otherwise conjugation either with glucuronic acid conjugation, or it can conjugate with glycine or with sulfate or with acetate. So the drug can conjugate with these compounds, mainly endogenous compounds present in the body, and convert into its polar compound. So the drug may conjugate with this endogenous substance, and the drug will finally becomes a excretable form, which is water soluble form. So it needs enzymes. There are some oxidative enzymes responsible for oxidation of drugs, reductive like reductases, and in hydrolysis like esterases, aminases are some example for the enzymes which are responsible for hydrolysis. Like here also it needs oxidation. There is one important cytochrome P450. This is the enzyme which is oxidative enzyme, which is a heme protein responsible for the metabolism of many drugs. So oxidation by some oxidative enzymes, reduction by reductases, and hydrolysis by esterases and aminases. Similarly, it needs UDPG here, glucuronic acid, and also glucuronyl transferase, like here glycine transferase, sulfyl transferase, and acetyl transferase. All the enzymes responsible for conjugating the drug with these endogenous compounds and converting themselves into the water soluble compound, and can be easily eliminated out from the body. So these are all the two mechanisms of metabolism or pathways of metabolism of drugs. Either drug will metabolized by phase 1 pathway or phase 2 pathway. Phase 1 includes oxidation, reduction and hydrolysis, and phase 2 includes mainly conjugation, that is either glucuronic acid conjugation or glycine conjugation, acetate or sulfate conjugation. So the next topic to be studied in this metabolism is factors influencing the metabolism of drugs. So what are all the factors which will influence the metabolism of drug? So what happens when the metabolism, there are some factors which will increase the rate of metabolism. There are some factors which will reduce the rate of metabolism. What happens when the rate of metabolism is increased? So the metabolism of the drug will be also increased. Once there will be increase in metabolism, see, metabolism is converting active into inactive drug, and if it is faster, so more and more inactive drugs will be accumulated and it will be eliminated out from the body, but the active form, that is intensity of the action, therapeutic action, or the duration of action will be very less, because the drug is immediately converted into inactive form of drug. So active form is not available for the showing any therapeutic action. So it will have less duration of action and less intensity of action. So when metabolism, rate of metabolism is increased, so the intensity of the drug and duration of action of the drug will get reduced. Why? Because metabolism leads to inactive form of drug, whereas when metabolism, rate of metabolism will be reduced, these both will be increased, because when metabolism is reduced, conversion into inactive form will be not possible. So more and more active form of drug will be available, so intensity of the action will be more. Is it beneficial always? No. Sometimes this intensity, the drug concentration available may be more than the therapeutic drug concentration, which may become toxic. So that is the reason why you have to consider the metabolism rate. There should be normal rate of metabolism. It should not be either increased or decreased. If it is increased, then there will be less therapeutic activity. Whereas if there will be reduction in metabolism, will leads to toxicity. So we have to consider what all the factors which are going to affect the metabolism of drugs. So the factors, let me list out the factors which are going to affect the metabolism of drugs. So first is the age, and then next is the species and strain, and then the gender or the sex, either male or female having the effect, and then of course the hereditary factor or the genetic factor or the racial factors. So hereditary and genetic factor are going to affect the race of the human or the living organism. So that also will have the effect on the metabolism of drug. Then we have enzyme induction or enzyme inhibition. There are some drugs which are responsible for inhibition of the enzymes responsible for metabolism or induction of those enzymes which are responsible for the metabolism. And lastly, miscellaneous factor. There are some factors, other factors which are going to again affect the metabolism of drug, like we have diet and dietary components, then the pathological state, circadian rhythm, biological clock as we say, also the hormonal disturbances also causes the change in metabolism. So let me explain the different factors, how are they going to affect the metabolism of drugs. So first is age. We know already the newborn will have deficiency in both oxidative as well as glucuronide conjugative enzymes. All the enzymes which are responsible for mainly the oxidative enzymes, also the glucuronide conjugative enzymes, will be deficit in case of newborn. When the baby is born, they will have less amount of these metabolizing enzymes. But as they grow, they from the day to the metabolism enzymes also increases rapidly, and it will attain to adult level about 1 to 2 months. Within 1 to 2 months, this infant or the newborn will attain the adult level of metabolizing enzyme. Can we have an example for this study about age? Example is tolbutamide. You might be knowing this is used as an anti-diabetic drug, and there are some diabetics in the newborn babies also which are known as juvenile diabetes. So for juvenile diabetes, this tolbutamide will be prescribed, which is having half-life of about 40 hours in case of newborn, whereas in adults it is about just 8 hours. Why this half-life has been increased? Because of less oxidative enzyme that is present in the newborn. Because of the metabolizing enzyme responsible for metabolizing this tolbutamide is less in amount in the body of newborn, this drug cannot be metabolized and it will remain in the body for about 40 hours. So the half-life of this drug in case of newborn is 40 hours for this drug, whereas in case of adult it is just about 8 hours. And one example for this glucuronide transferase deficiency, the conjugation of chloramphenicol drug. The chloramphenicol, a commonly used antibiotic, it is also used in babies. Because of impossibility or deficit in the glucuronide conjugative enzyme, the drug will have inability to conjugate with this glucuronic acid. So it will be accumulated in the body, which will lead to gray baby syndrome. So you might have heard there is a syndrome which is occurred by this, which is caused by this chloramphenicol, which is gray baby syndrome. Why this chloramphenicol caused gray baby syndrome is the reason that its inability to conjugate with enzymes, glucuronic acid. Another example, kernicterus. Kernicterus is nothing but hyperbilirubinemia. That is, bilirubin concentration in blood will be maximum and leads to, what is this kernicterus? Having mental retardedness in the baby. Mental growth or the brain development of the baby will be less in case of bilirubin concentration more in babies. So what happens? Bilirubin concentration in blood will be more. Why? Because the bilirubin's conjugation with these enzymes, that is glucuronide enzymes, because of less amount of glucuronide enzymes in case of newborn, leads to this hyperbilirubinemia. Bilirubin cannot be conjugated and it is available as the free form in the blood, leads to cardiac tears or mental retardedness in the baby. This is another example in case of age. Now we discuss about the species and strain. So there are different species and they have different metabolizing enzymes. Say for example, cat lacks glucuronide transferase enzyme, whereas pig lacks sulfide transferase enzyme. So since cat is not having this glucuronide transferase enzymes, the drug which are conjugated by this glucuronide transferase, like in case of amphetamine will be conjugated by the sulfide conjugation will be there, whereas pig has no sulfonyl transferase enzyme, so this same drug will be conjugated by glucuronide transferase enzyme. So there is another example, like we have like humans, pigs, rabbits have difference in the metabolism. Like amphetamine has two types of metabolism. One is oxidative deamination and another is aromatic hydroxylation. So humans, pigs and rabbit undergoes oxidative deamination, whereas rat, which is the another species, undergoes the aromatic hydroxylation. So the metabolism also varies different from these two types of the species. So when the species are different, they have difference in the metabolism also. The metabolizing enzyme which are present in the body of different species are responsible for metabolizing. Like in case of example, we seen amphetamine. Amphetamine has metabolism by either oxidative deamination and aromatic hydroxylation pathway. Humans, pigs and rabbits undergoes amphetamine metabolism by oxidative deamination, whereas rat undergoes aromatic hydroxylation as the main pathway for the metabolism of amphetamine. We are talking about species. In the same species, like in case of rabbit, we have different strains, like cotton-tailed rabbit is there and we have New Zealand rabbit. So these both do have difference in metabolism. They are different in their strains. They are rabbit. Species is rabbit, but their strains are different. One is cottontail and another is New Zealand rabbit. So hexobarbital, the drug hexobarbital metabolizes 10 times faster in case of cottontail, whereas slower in case of New Zealand rabbit. So even the same within the same species, if the strain is different, the metabolism also varies. So this is some example for species and strain. Of course, gender. We know already male has faster metabolism than that of female. It is also proven in case of animals using mice and rats. The male rats metabolizes the drug more faster than that of the female rats. Then next factor is hereditary factor or genetic factor or the racial difference. If there are difference in the genes, there will be difference in the races also. So the example for this drug is isoniazid. The antitubercular drug isoniazid is metabolized by N-acetylation. So conjugation, that is phase 2 pathway, acetylation takes place in case of isoniazid, and some races will be considered to be rapid acetylated. Some will acetylate this drug faster, whereas some will acetylate this drug slower. That is, metabolism of this drug will be faster in some races, but the metabolism will be slower in some races. Those races which are faster in metabolism, they are known as rapid acetylator, and the races which are slow in metabolism of isoniazid are known as slow acetylators. So who comes under this rapid acetylators are Asians and Eskimos, mainly considered to be the rapid acetylators, whereas the Egyptians and Mediterranean Jews, they are slow acetylators. Now, what is the problem with this rapid acetylation or slow acetylation? So, the Asians and Eskimos, mainly they are rapid acetylators. As they are rapid acetylators, their metabolism will be very faster and the action, the therapeutic activity will be less. Their therapeutic action, what for the drug is used, that action will be less in case of this isoniazid for those races belongs to Asia and Eskimos. Whereas Egyptians and Mediterraneans who are slow acetylator, they have reduction in their metabolism of drugs. So reduction in metabolism leads to accumulation of more and more isoniazid and causes so many ADRs, that is adverse drug reaction will be caused by isoniazid. One such is peripheral neuritis. Peripheral neuritis, and another is erythematosus. Two such adverse drug reaction will take place because of isoniazid in case of slow acetylation, that is because of the races. As the races are different, their metabolism also is different. For the Asians and Egyptians, they are rapid acetylators, so activity is less in them. Whereas in case of this Egyptians and Mediterranean Jews, they are slow acetylators, so metabolism is reduced and toxicity is increased, may cause this neuritis issues, peripheral neuritis as well as erythematosus. Problem will be more in case of these races. It is mainly due to the changes in their genes, that is genetic or the hereditary factor has been changed in them. And the next factor which are going to affect the metabolism is enzyme induction and enzyme inhibition. Enzyme induction means some drugs are responsible for inducing the enzymes responsible for metabolism. Already metabolism is conversion of active to inactive form of drug. When there is induction of enzymes, more and more inactive form of drug will be there and drug will be eliminated faster from the body. Like in case of polyhydrocarbons, mainly polycyclic hydrocarbons, that is in case of smoking. This will induce the drugs like theophylline, and there are drugs like phenobarbital has induction effect in the drugs like warfarin. So there are some drugs which will induce the enzymes of enzymes which are responsible for metabolism of other drug. So the metabolism of the other drug will be increased and it will be eliminated out from the body. Like in this case, phenobarbital induces the enzyme responsible for metabolism of warfarin. So as it induces the metabolism, warfarin is responsible for its anticoagulant activity. So when there are so much bleeding will be there, for that anticoagulant property, we administer this warfarin. So what happens? Warfarin's metabolism will be more because of this phenobarbital. When you go administer phenobarbital, warfarin will metabolize faster and it will remove out from the body faster. Its active form of drug will be not available for its therapeutic action and their anticoagulant activity will be further reduced. So may lead to bleeding in the body. So this phenobarbital will affect the enzyme responsible for warfarin metabolism. Like in case of enzyme inhibition, the reversal effect takes place. So some drugs will inhibit the enzymes responsible for metabolism of the drug. So what happens? That metabolism will be reduced more and more toxic amount of active form of drug will be accumulated in the body, which leads to toxicity. There are two effects in this enzyme inhibition. Sometimes the mechanism of one drug's therapeutic action will be because of this enzyme inhibition. Like in case of example, carbidopa. We administer this carbidopa along with levodopa in case of Parkinsonism. We already discussed this in blood-brain barrier. So, carbidopa is given along with levodopa. Levodopa is going to act in Parkinsonism, but carbidopa has no action in this Parkinsonism. What for this carbidopa is given? To inhibit the decarboxylase enzyme, which are responsible for conversion of levodopa into dopamine. So decarboxylase inhibitor. Decarboxylase is an enzyme which is inhibited by this carbidopa. Sometimes this enzyme inhibition is used beneficially like this. Also MAVO inhibitors, monoamino oxidase inhibitors like adrenaline or adrenaline, they are considered to be the monoamino oxidase. So that inhibitors, again, that is also a beneficial effect of this enzyme inhibition. There are some harmful effects also which leads to accumulation of the drugs in the body, like grapefruit juice. Grapefruit juice cannot be given along with the drugs like calcium channel blockers like felodipine or the immunomodulators like cyclosporin. These drugs will have enzyme inhibited by the grapefruit juice. So it will reduce the metabolism of these drugs and it will cause the accumulation of the drugs in the body and may cause toxicity. So grapefruit juice reduces the inhibits the drugs metabolism like felodipine and cyclosporin. So there are some miscellaneous factors which are also going to affect the metabolism of drug like diet, like protein and carbohydrate ratio. So we eat rice or rotis along with dal or sambar. So what for? To have a balanced diet. We eat carbohydrates as well as proteins. So this ratio also should be normal. If this ratio is completely different, again the metabolism of drugs will be affected. Then pathology, like mainly the diseases in liver will lead to changes in the metabolism of drugs because liver is responsible for metabolism, right? So metabolism will be affected because of some liver disease like hepatitis, hepatic cancer or cirrhosis may have effect in the metabolism of drug, as well as circadian rhythm, that is the biological clock, also has effect in the metabolism of drug. Also hormonal disbalance, if there are some imbalance in the hormones, also leads to changes in the metabolism of drugs. So in metabolism we have to study two things. One is the pathways of metabolism, phase 1, phase 2, and the factors affecting or factors influencing the metabolism of drugs. So these are all the factors like age, species strain, gender, hereditary or genetic factor, enzyme induction inhibition, and some miscellaneous factors. In my next video, we will discuss about the excretion of drugs. Excretion includes renal and non-renal excretion. We will discuss in my next video. Thank you.